Welcome back. Talking COVID-19 or the coronavirus pandemic here live on ITV networks. It is a Wednesday morning, a 22nd day of April 2020. From Dubai, we're going to one of our neighboring countries, and that is Botswana this morning, where inshallah we're going to be unpacking or hearing what's the condition like with regards to the lockdown in Botswana this morning. We are joined by Laurie James, who is from Botswana. She has been on the screens of ITV before. We say good morning to you, Laurie, and thank you for joining us this morning on our COVID-19 update show.
Good morning, Zaheer. Only a pleasure to be here.
When we look at the lockdown, day 27 of the lockdown in South Africa, what is the lockdown like in Botswana, and how many weeks has it been ongoing for so far?
Well, we are currently in our third week. It's been pretty much the same as South Africa, I think. We're in our homes. The difference is here in Botswana, most people are really compliant. We are allowed to go to the shops to do our shopping. We're allowed to go to the agricultural shops to get food for our animals. Other than that, we pretty much at home. The curfew, we're allowed out between 8 and 8. After 8, you need to be in your home. The conditions are good. The country is very compliant. At the moment, we seem to be fairly effective in containing the virus. We only have 20 cases and 1 death at the current time, So it's being very closely monitored.
Is Botswana then under a state of disaster or a state of emergency?
We are under a state of emergency that was declared a week ago by our president and will continue for 6 months.
So do you have any indication with regards to how long the lockdown will be, or is it going to be, like you say, for a gradual easing of the lockdown for the next 6 months?
Well, we were originally locked down until the 30th of April. There was a communique from the Department of Health yesterday indicating that they are most probably going to extend that lockdown for at least another 3 weeks until the 3rd week in May.
You made mention of the response of the citizens being a very good response. Many of the citizens of Botswana hearing the call of the lockdown. When it comes to what the people are feeling on the ground, or what you have been hearing with regards to different citizens in Botswana, what's the overall feeling of the community of Botswana?
Look, I think Botswana is a little nervous of the situation of COVID. Obviously, we have a reasonably high incidence of or comorbidity of HIV, and we also have TB. So our government has taken every precaution to contain the virus before it actually even really gets here. We brought in the World Health Organization early to help plan. So I think the citizens, although being concerned and very aware, the incredibly good thing about Botswana is that our citizens tend to be compliant. We tend not to have violent reactions to things. People are considered their actions well. Our government has been exemplary in communication. So we get broadcasts, we get the number of tests, the number of people in quarantine, exactly what our numbers are, and these are sent out. So there's very good communication, and of course, when you have very good communication from your government, you tend to have buy-in from your citizens. So yes, we are fortunate in that our citizens are compliant.
When we look at South Africa, we know even worldwide the impact of the lockdown that it has on the economy of any country that the COVID-19 pandemic is in, or a country that is in a state of emergency or state of disaster or lockdown. What has been the impact with regards to the economy of Botswana?
Look, just as is with every other country in the world, I do feel that we will suffer economic impact. Our country is very reliant on diamonds. However, they are taking steps to mediate this. The government has put numerous measures into place to assist businesses and so on. What we are also doing is we've had calls from our innovation hub for people to put forward solutions that can assist with the COVID situation. The University of Botswana is working on a number of solutions, and so they are trying to stimulate growth in the technical side, calling for apps and innovative solutions that could be used in the COVID situation to uplift communities and so forth and so on. So they are doing everything to stimulate the economy, but obviously there is concern. Botswana is highly reliant on the diamond industry.
And then also, I presume, highly dependent on the imports itself from South Africa. What is then the situation at the borders? How long is the expected border closure going to be?
Look, we expect from the communique from the president that our borders will be closed for the next 6 months. However, there are measures in place to make sure that essential goods do get through the border. What we do is the trucks are allowed through, they're then given a monitoring and a trip sheet. Their movements are monitored and then until they are moved out of the country, so that if anybody brings anything into the country, they are trackable, and we can track their movements, and that way immediately test everyone that they came into contact with. But our borders are at the moment strictly closed to tourism. Our airports are closed. We have managed to evacuate most of the citizens of foreign states. Recently, there was another aircraft that left with German citizens. So there is some repatriation going on, but that's really the only movement of citizens is out of Botswana, really, not into Botswana.
You make mention that the government's dealing of the crisis has been exceptional. Paint us a picture with regards to the health facilities in Botswana itself and the health department's dealing of the crisis.
Well, the health department, as I said, their communication has been outstanding. We received a notification yesterday, and I'm not sure what's behind that the president has removed the permanent secretary and the deputy permanent secretary of the Department of Health. Perhaps he has another plan there. But our University of Botswana is working with a an absolutely state-of-the-art facility, the Sir Ketumela Masiri Hospital, to house the COVID patients there. As I said, it's not a crisis at the moment. We only have 19 patients. We had one death, who was a 79-year-old woman who was actually only tested positive after she passed away. So we do have, as I said, state-of-the-art facilities. Our university is working with partners to produce ventilators. We have psychosocial support in place where the university is providing psychological assistance to all of our healthcare workers on the ground to make sure that they are properly supported. So at the moment, I don't think there's much more we can do in terms of support. Our university has also put together a tracker for our country, technology-wise, that they can track and trace any COVID spread, and that decisions can be made in real time by the government. So, and Botswana responded early, and I think that's made the difference. We closed our borders early, we closed our airports early, before we even had cases. Most of the measures were in place. And we also had the World Health Organization's assistance already from January in planning for COVID. So in my opinion, the government has done, and President Masisi has done exceptionally well on the containment side.
You make mention of a key word there, universities, Laurie. We know this academic year of 2020 is all in shambles at the moment. Also in South Africa, we see. What's the latest with regards to education institutions in Botswana? Are they going to be opening, or is everything moving to e-learning?
Well, at the moment they are closed, or everybody is closed, and we did get an indication that they would remain that way for the next 6 months. However, the COVID situation is in flux. obviously, everywhere in the world. And I'm sure decisions with a state of emergency, the president can move fairly quickly if there are changes on the ground, and we could possibly get our children back to school earlier. But they are calling for education portals. The work is going out to the children. It's being marked. So hopefully they're not and there is support online for schooling. And all those parents out there that thought they would could do a better job than teachers, well, we're hoping they'll take the opportunity and prove them right.
Yeah, that's on the lighter side of things. Definitely. Laurie, any closing comment from yourself with regards to living under a lockdown? First time we've experiencing it, and also Botswana, a lockdown, as you make mention, state of emergency for the next 6 months. Any closing comment for our viewers of ITV?
Yes, I definitely do have a closing comment. Rather than sit at home and become depressed, I really feel there are so many online resources. There are free courses everywhere, Coursera, Udemy, edX, Stanford Online. Use the time, upskill, learn a new skill, take up an exercise program. There's plenty on YouTube. Use the time, come out of COVID, a more skilled individual, ready to contribute to society, because we are going to need additional skills as we come back from this, both economically and personally, I believe. So I don't think get depressed. I know it's a difficult time, especially for those in solitary confinement or isolated on their own, but try to stay upbeat, take a course, do something that you've wanted to do for ages that you just haven't had the time to do, and mostly just try and stay in a positive frame of mind. We will get through this.
Laurie James, a message of positivity and hope, a very inspiring message there from yourself to the viewers. We hope that everybody will reflect upon those words and take up your challenge of trying to come out a better person from the COVID-19 pandemic. Thank you so much for joining us this morning. We wish you and your family the best. Please do keep in a safe health at all times as well. Till we speak again, thank you. Good morning to you, and thank you so much for joining us.
It's my pleasure. Good luck.
Good luck. That was a Botswanan resident, Laurie James, explaining to us the condition there in Botswana. As she mentioned, 6 months of lockdown, they're in a state of emergency. We all are asking the question, is South Africans going back to school in the next 1 week or so? They are not going to school for the next 6 months, so we will have to keep an eye on that as well. But as she made mention, the amount of cases there in Botswana, around 20 at the moment, with 1 confirmed death. So a very small scale of coronavirus infections when it comes to our neighboring country. But as she made mention, we need to use this time to come out a better person after the COVID-19 pandemic.